Great, thank you everybody for coming. I think we just about squeezed people in almost everywhere we can. We've got a few spots left, but hopefully you're not too squashed. Thanks everyone for coming. My name is Carrie Brown. I'm the Executive Director of the Vermont Commission on Women, and you are part of our 50th anniversary celebration. This year, 2014, is our 50th anniversary, and we've been celebrating with events around the state, focusing on all kinds of different aspects of things to do with improving the lives of women in Vermont. And we've asked our commissioners to take the lead on events in their parts of the state. And we had our meeting today here in St. Albans. Normally we meet in Montpelier, and so we've been traveling all around. And we're very grateful to Danielle Martell, our commissioner, for putting this panel together. We've been paying attention to the needs of incarcerated women and women under correctional supervision for quite a long time now. And we have most recently, in the past year or so, made it one of our top priority areas. We were, along with our partners in the Women's Legislative Caucus and Vermonters for Criminal Justice Reform and Vermont Law School, put on a conference about the Incarcerated Women's Initiative last week. Were there some people here in this room who were at that conference? Yeah, I thought so. And we are holding this event tonight as a way to continue the conversation, to hear about what's happening in St. Albans, to get us all engaged and how we can just really make things better and celebrate the successes that we're already having. Couple of housekeeping things. You'll see on your seats are some yellow forms. If you should feel so moved to give some input about this event at the end, we really greatly appreciate it. It helps us to make our work better in the future. If you need the restrooms, just hop up at any time. Don't worry about disturbing the panel. It's kind of crowded in here, but that's okay. Out this door, and then to the straight across and to the left, there's a stairway going downstairs, and that's where the restrooms are. So now I'd like to introduce Danielle Martell, our commissioner from St. Albans, and she's going to get us started. Thank you.
Hi everyone, thank you very much for coming this evening. I am very excited to see all of our panelists here. I thank you all for all the work you've done already to help women in this certain population, and I'm looking forward to hearing everything that you have to say tonight. And I would like to introduce our mayor, Elizabeth Gamache, who's going to be moderating the event tonight. So thank you.
Thank you, Danielle, and thanks to our panelists for joining us. This is a wonderful, wonderful group of folks that we're really eager to hear from. And thanks to all of you for joining us tonight. I'm so pleased to see such an outstanding turnout for an event like this. I think this speaks volumes of our community, that we are very interested in having conversations about how we help all members of our community to be successful, and I look forward to hearing about what some of our successes are and where we may have some gaps that we can fill. And after we go through a few rounds of questions with the panelists, we really want to create a space, time, and a place for us to be open to questions from the audience. So I'm going to moderate the responses, keep track of the time to ensure that we'll all have time to ask questions and share feedback throughout the course of the next hour and a half or so. So with that, I will begin. And the first question is going to be a question that I'll ask all of the panelists to answer. It's an easy one. I'm going to ask you to introduce yourself. And after that, tell us about what you and your organization do to help provide successful reentry for women who are coming out of incarceration or in supervision. So I'll start at this end, and then we'll mix it up a little bit. But Kathy, would you introduce yourself?
Sure. Hi, my name is Kathy Ainsworth. I am the Director of Grants Reporting and Evaluation at Mercy Connections. We are an educational nonprofit in Burlington, Vermont. But I have two hats. I'm also a resident of Sheldon. I grew up there. I live there now. And I went to BFA St. Albans and worked in the superintendent's office for a duration of time. So I have vested interest in this. The Vermont Women's Mentoring Program is one of the 3 core programs at Mercy Connections. We train, support, and provide opportunities for volunteer women in the community to match up with women who are incarcerated or just barely released or post-incarceration to have a really worthwhile relationship. And basically what that does is change the story with people. Most of the women that we serve are, they're just dealt these cards. And we are all women, and we all have things in common as women. So the focus is really to reduce risk by intervening and providing a very transformative experience of having somebody there no matter what, who's not paid to be in your life and who can remind you of the beauty that you hold inside.
Thank you.
My name's Tiffany Bloomley, and I'm the Executive Director of Vermont Works for Women. And we've worked in corrections for about 12 years, 14 years, and really started in earnest when the women were housed at the Dale facility. It was brand new. That was in Waterbury. And our suspicion was very few women had a lot of history, success in work. And so, and we began offering training programs for women by building dog houses on a smoking porch that was available to us. And it was quite a leap of faith for the Department of Corrections to allow all of our power tools in the facility. And but the programming we've offered has changed over time as women have moved through the system and at different locations. When we were up at Swanton, we were building modular homes. We graduated from dog houses to modular homes that were then sold as affordable housing. And now at the Chittenden-based facility, which really doesn't have a lot of space for vocational training, we work within the facility in a variety of ways. But our focus really is on job readiness and helping link women who are coming out to programs or jobs, depending on what they need and what they're ready for.
Thank you. Scott?
Yeah, I'm manager of case management in the hospital system, and we serve, of course, patients all throughout the community, and both inpatient for needs for kind of acute care. Our emergency room is a very busy place, so of course we see a lot of folks come through there. We also have primary care. We recently, last month, opened our urgent care, which is now behind the hospital, so it's a good access for someone who doesn't have primary care, so that women can come directly in if you need to be seen right away or have kind of an acute thing but not an emergency type situation. We don't have a primary care direct link. We would like one. We would like to be able to have access directly, or maybe a proactive means before people are discharged to set up, so that we do have a primary care appointment immediately afterwards. So we're open to discussing that. Through our pain management office, Dr. Robert, who's here with us tonight, we have a great program there. We work more directly with some of those folks through that office. Those are special needs. These are people that might have some addiction management that we need to focus on. And certainly through that, we have care coordination to a lot of community services, some that are here, so that we can meet their needs as well. We do try to focus on all the needs, whether they're inpatient through pain management, that we look at. We have 2 social workers in the hospital. We have another one that's available, so we have a lot of resources if there are those social needs that we need to focus on. And through, of course, our primary care, we also work with the community health team that are in our offices also to look at the other needs that are there. So a pretty broad range, and of course we partner with all the local agencies.
Thank you.
Julian?
My name is Julian Denoy, and I'm employed through Northwestern Counseling and Support Services. We are part of the collaboration of the Challenges for Change grant through the Community Justice Center that provides case management for incarcerated individuals coming back into the community. We also, part of that grant is the Voices Against Violence. Many of the women who have been incarcerated suffer trauma and they have an opportunity to go through housing, transitional housing with Voices Against Violence when they're re-entering into the community. Also, the Tim's House, the shelter, is part of that grant, and they provide housing for individuals who are transitioning back into the community. And that's about it.
Hi, Jim Gibson with the Probation Office. What we do is we coordinate the release back into the community, and then also refer to outside agencies for their needs. As Julie was saying, we do work with the Community Justice Center, Lori's House, Samaritan House. We refer for risk reduction needs to substance abuse, mental health, social services, and we refer them for housing. We work with Community Justice Center again for housing, Samaritan House, and Pathways, and we just try to be the stabling force behind them and guide them in the direction that they need to go.
Thanks.
Yeah.
Hi, I'm Candace Lewis. I'm an academic coordinator for the Community College of Vermont here in St. Albans. Our student population is made up of a broad spectrum of people from Franklin and Grand Isle counties. Oftentimes when thinking about the specific population of women in reentry, we usually will see people who, after their basic needs have been met in other ways, have been identified or encouraged through mentorship to continue their education. And so I would say that while we don't have any specific programs that are related to this population, we certainly do see them, and we see some unique needs in that population.
Great. Thank you.
I'm Danielle Lindley. I am the program director for the Parent-Child Center out of the Family Center in St. Albans, and also oversee adolescent services. Our role in the community is to really provide holistic services and programs for young children and their families. We focus from birth and prenatal to the age of 8. I think I was really asked to attend this panel because many of the women coming out are also mothers, which means they have families, and so I see that as an important role for us to really support their transition back into the community and ensuring that they're getting the programs and services that will help their families. I'm really using this as an opportunity to know that parent-child centers can have a key and vital role in this, and so how can we strengthen that partnership? Because we don't have any specific programs right now that really target this population, but clearly it's a need, and I think that we're really willing to be a support and a collaborative partner in this as this progresses. So I'm looking forward to the conversation.
Thank you. Chris?
My name is Chris Lukens, and I'm the director of Voices Against Violence, Lori's House, and we were already mentioned. We are the local non-governmental victim advocacy organization that provides services to survivors of domestic and sexual violence and stalking and their children. And we do that in a number of ways. We have a shelter, which is Lori's House, and we have transitional housing. We have apartments in the community. We also have a supervised visitation program that provides safe visitation for families where there's domestic and sexual violence and there's a risk for the children and for the victim. We also do outreach and education in the community, so that's kind of what we do. We became involved with this population when the women were actually housed here in Swanton at the correctional facility, and our network, our coalition, state coalition, had a program called DIVAS, D-I-V-A-S, which is, I don't know if I even remember what it means, discussing accessing it. Yeah, there we go. Okay. Oh, it's right in front of me. Thank you. Discussing domestic violence and accessing support. Mainly because about 80% of the women incarcerated have issues, domestic and sexual violence issues in their past. They have trauma issues, and if we're not serving that population, we're not serving a good portion of the domestic and sexual violence survivors in our community. So we got involved in that, and when the women moved up here, we took on that program, and so the person providing that service in the facility was actually an employee at our program. And it was an amazing program, and it was an amazing eye-opener for me to really go into the facility, talk to the women, learn, hear their stories, and just, it was absolutely amazing. When they moved, we unfortunately, the program kind of went elsewhere. But we also work with our Community Justice Center, as was mentioned, and we do have a transitional apartment, so when women come out of the facility or they're under DOC supervision, we can provide some transitional housing for 3 to 4 months and help them get back on their feet. We provide those support services and in working with them in the areas of domestic and sexual violence. We also have done support groups for women that were under DOC supervision or coming out of the facility as well. And we were probably the first one, maybe because we had the DIVAS program here, we were probably one of the first domestic violence shelters in the state to have women come directly from the correctional facility into shelter if needed.
Thanks. Hi, I'm Sheila Perrott, branch manager of West Staff in St. Albans. We're a staffing agency, but I'm sad to say we don't have a program because we're owned by a corporation. We have a lot of rules, so we can't really assist people or from corrections into the workforce. We would love to, and this is why I have brought 2 women from our office, because most recently we've been brainstorming, and we've decided that even though we can't help later, they're clearly, from all of us living in Franklin County and working here, there's clearly an issue. I think women as young as 14, maybe even 13, need some kind of, we've decided that we're going to reach out to them before they hopefully get into trouble or make bad decisions. So we can't help on the end, but we've decided to connect with the local high schools in Franklin County. We were going to talk with them to see if we could perhaps go in once a month. We initially thought we would speak with seniors, but most of the young women that come into our office have not made it that far. Most of them have not graduated. Some have only been to high school possibly a year. So there's definitely something going on, and it needs to be addressed, I think, before we're all here in this room. So this is what we're doing. Kelsey is my personnel supervisor. She's had some great ideas because she's also worked in the school district. Did you want to add anything? Tell us about what we're going to be doing.
All right, I'm Kelsey. I also work at West Staff. I'm also been a member of this community my entire life. I'm born and raised in Franklin County. And so it means a lot to me to be able to do something. I see a lot of people that I went to school with who maybe they have their siblings or having children of their own, and they're not where they were hoping they would be, whether it's their own choices or maybe they were victims of some sort of trauma and that took them down a path that made things worse. But we see how important it is that we have to get out there, everybody, whether we feel like we have these major connections and programs or not. Everybody needs to take a chance and get out there within our community to help each other. We can't help ourselves unless we're willing to help everybody around us. And as a whole, I feel like as much as our community has seen all this negativity and all this trouble, not just with women, but with everybody around, we're not going to get anywhere unless we're all willing to stand up and pitch in and care for each other. So yeah, West Staff does not have a program right now. We really can't do a whole lot with women who are exiting incarceration and trying to get back into the community, but maybe we can do something to prevent the incarceration. Maybe there's something we can do to early on steer them in a different direction, and it's just going to take all of us to do it.
We kind of just want to open their eyes, these young women, 13 or 14, what some of their choices will be ahead.
And I'm Trisha Jarrett, and I work with these 2 wonderful ladies. I think they've pretty much described it, but and this is not something that our corporate office expects us to do, or even our franchise owners expect us to do, but we're just based on seeing men and women. I realize we're women, but men and women who come in the office who clearly have not been prepped on what to do and how to behave and what to expect, etc. we thought we'd try and be proactive. So what I would say is that if anybody in here, you know, our initial idea was to, again, reach out to the high schools and guidance counselors and et cetera, and see if there's something that we can bring to the table that is different from what they're offering. So if anyone in here has some ideas around connecting those dots, then here we are.
Great. Well, this is wonderful to hear all of these introductions and the background that brings you to the caring and compassionate work that you do for our community. I think it's really exciting to hear from you that you have some limitations, and that's not preventing you from looking to see how you can contribute to finding solutions to provide more support for women reentering. When I hear the different descriptions of what you do, some key themes emerge that I think is often easy for us to take for granted, just how many pieces, basic pieces of the equation go into being successful. And it's important for us not to take those for granted. So in no particular order, I hear about safety and security, the importance of family, mentoring, of course, having a way to make an income, jobs, the health of our community members, whether it's mental health or physical health, education. How do we make sure that we're providing support to ensure that success? And overall, how can we work together to understand the needs, understand what's working, acknowledge and appreciate the successes, learn from those, and then look to where we have gaps. So with that in mind, I'm going to move to the next question. And what I'd like to ask, and we don't have to go down the row, we'll do it kind of popcorn style if you have an answer and you'd like to share it. The question is this. What strengths currently exist in St. Albans in our community that other communities could learn from us? What are we doing right in providing support for women reentering? I'll open it up to the panel. Anyone want to go first?
I think Franklin, and we serve Grand Isle as well, but we have great partnerships. We have great collaboration. I don't necessarily hear that throughout the state and other communities, but we work really well together. We have a very strong community justice center that really supports a lot of this work. We have a great relationship with probation and parole. You know, for instance, as I mentioned, we were, I think, the first domestic violence shelter to have people come right from the facility into our program. And then we were concerned about, okay, so what does that look like? That means, you know, they're under supervision, so that's FSU, and you'll tell me what, I always forget what FSU means.
Field supervision.
Is going to be, you know, knocking on our door. And so we actually talked with probation and came up with a different plan so that probation officers weren't coming to the shelter to check on the folks. They were doing that elsewhere, and they were fine with that, you know. So it really enabled us to work together and really come together, you know, to solve a problem that you know, would have existed and would have disrupted a lot of other people staying at the shelter. So those kinds of things, I think, are really have been really beneficial in Franklin
What do you think makes us more collaborative? Because I hear that a lot about the St. Albans community in Franklin County, that we do collaborate well. Any thoughts on what enables you all to collaborate so effectively with one another?
I think there is a good sense of just community involvement that people do. I mean, we work with every one of the agencies. We have someone that goes into Tim's house regularly. I mean, we have a lot of, there's a lot of eagerness that people are willing to step in and help, or if you call for help, they respond.
Great.
Yeah, I think it's a lot.
Yeah, this work is so difficult that if we were working in silos, we would not have the success rate that we do.
Just hearing the different areas that you all focus on, I could just imagine in silos it would be very difficult to put all the pieces together, and a lot of synergy and working with one another.
There was also, was it 14 years ago, there were regions in the state that were focused on community partnerships. We had the Franklin Grand Isle Community Partnership, and that was one of many that were really trying to focus on how do we support people over their lives. And I think that as we were doing that, we really developed a heart for the whole person and each person in our community and how do we serve them best. And actually there's a resurgence in the state called Benchmarks for a Better Vermont, and there are initiatives in the state of Vermont that are really trying to help with that again, how really helping communities and the state level and also all the way down to just the individual service providers identify and communicate effectively on how much are we doing, how well are we doing it, how are people better off, how do we work in lockstep so that we're meeting community outcomes, and it's really nice that that's resurging because I do believe that there are elements of that still within this community. I recognize it. You know, it's nice. It's really nice.
I would definitely echo that. I think that our community is really great at stepping back and not saying that that's not my job, and really looking at it and saying at some point down the system of care, this family is going to need us, so let's look at it holistically and intervene at what point the family comes in and really approach them in a way that is going to be beneficial versus saying, you know what, like I can't really do that, I'm going to wait and I'll make a referral somewhere else. It's really a collaborative piece. And I think acknowledging that there are a lot of things going on in Franklin and Grand Isle community right now, and so we have to look at populations and subsets of that and make a commitment to really look at the outcomes of that, and it can't be just in the silo about the individual programs. And I can definitely hear some of the what I call the RBA language moving through our system of care and really saying that we need to be accountable. Results-based accountability.
Great. Yes.
Perhaps something I would add to that, and I see this in the education and training field in Franklin County, is that there seems to be a, what's the need, what's the problem, how do we get it solved? Similar to what you're saying, you know, let's not pay so much attention to what the rules are, what we can do, what we can't do. Let's figure out how we can do it. And I think
so focusing on solutions.
Focusing on solutions and identifying what needs are, and then figuring out how we can proceed rather than what can't we do.
What can we do, not what can't we do. That's important. Yes, Tiffany.
I'm a bit of an interloper because we're based in Winooski and don't run direct programs up here, though I've been involved in helping get Rosie's Girls off the ground up here in the school, and I was really struck. I just want to, like, you know, I was really struck when I came up here to talk with folks at the school. Well, I thought I was coming to talk with just school folks about Rosie's Girls, and there was this. There were like 12 people at the table, and they represented all kinds of different organizations. And I must have looked surprised because they asked me about it, and I said, well, you're all here, and you see the relevance, and that kind of holistic approach I think is great, and I do think it's unusual, and it may be in part by the product of your size. Because, you know, these are your neighbors you're talking about. And Chittenden County is that much bigger that I think things are more siloed there. And so I've been very impressed by that from Winooski. So,
thank you. Other examples of strengths that other communities could learn from by watching our area? All right, so that's great. I love focusing on strengths, and collaboration, compassion are tremendous. I think it speaks volumes to who we are and how we move through looking to find solutions to our problems. When you think about the framework that we have here in this area, are there other organizations or individuals that aren't a part of the effort to help reentering women be successful that we need to find a way to pull into the fold? Are there silos that we haven't broken down that could provide opportunities, or just areas, gaps that aren't engaged yet?
I am going to speak from a Burlington perspective for just a minute. Mercy Connections collaborates. We started the Vermont Women's Mentoring Program in collaboration directly with Department of Corrections and Vermont Works for Women. And those essential partnerships were the reason why we could do what we do. without any one of us, we would be not all there. And I think part of the really important collaboration that we actually don't have completely charted is the amount of, we have so many feelers out there for people who have a heart for people. I think that sometimes we overlook the fact that our neighbors can be involved, our church members can be involved, the people up the hill, the people down the hill, the people in between, everybody can be involved if there are clear channels in. And basically what that means for mentoring is if you feel the urge to be more compassionate, if you feel the urge to have a relationship that can really make a difference, it doesn't always have to be children. It doesn't always have to be, in traditional places. It can be through just being there for somebody, your neighbors. Mentoring is a huge commitment, but it takes very little to be a good mentor.
Great.
So
thank you. Thank you. Other thoughts on gaps? And let me ask this question. From your perspective, how are we doing as general members of the community, not experts in the fields that you serve in? How do you perceive the awareness of the issues amongst the community? Is there opportunity to raise that more, or is it in the right place, or is it in the wrong place?
I'll speak.
Okay.
I think the awareness could be raised. Just speaking from my particular role, it seems like over the last couple of weeks there was a resurgence in kind of talking about this, and again from my role in the children's world, but realizing there's such a link between obviously women transitioning out and their families. And so I know that there's a huge conference tomorrow that's going to be highlighting a lot of this, and so I think it definitely need some more education, particularly with this community and how we can support these women.
Other thoughts on the level of community awareness?
Well, this is probably a good opportunity to put a plug in for the Community Justice Center.
I was waiting for that.
The Community Justice Center has a program that's called COSA, a Circle of Support and Accountability, and there's always a shortage of volunteers. The way that program works is an offender is identified as someone who would benefit from having some extra supports, and falls in line with mentoring. They're volunteers. There are some commitments associated with that for the volunteers. There's training that's provided. There's opportunity to do some one-on-one work in building relationships, which offenders desperately need from the community, is to have a sense of community. And by contacting the Community Justice Center, if anyone's interested in volunteering, they could learn more about that program.
Great. And I'd like to just underscore one of the words you said, relationships. The importance of building relationships, and to your point, Kathy, how it can come in large and small ways. It can be the kind thoughts and conversations that you have to help out a neighbor, or it can be something bigger. So there are a spectrum, I presume, of ways for community members to plug in. One of the things that I think about, and why I asked about community awareness, is that sometimes there's a fear of having conversations about topics that we're uncomfortable with in the community. And so rather than having the conversations about how we move forward to seek solutions to provide more support, some communities, I think, just stop, don't have the conversation, look the other way. That's not my sense in St. Albans. I think this has been a community that's been willing to tackle our issues and our problems head-on. And it's encouraging to hear that you're sensing a resurgence of energy and enthusiasm for these conversations. That's really important. Any other thoughts on the question for this round, where we're looking for
For more
individuals or
exposure, if I could
organizations?
comment on that, I do think that there is a lot of room for, particularly with this population, for businesses to be better informed. You know, it's great to have you openly say, you know, you have some roadblocks to be able to help these women. And certainly there's a lot of, the hospital screens everybody, so we have our roadblocks that are built in. But there are plenty of businesses that might not understand the need, and empowering that person who comes out with a job is one of the biggest thing that they need to be able to survive going forward. So I think reaching the business community as employers would be a big step, and maybe developing programs that could help them or support them in bringing these people in.
Great, thank you.
Can I just say,
Sure.
I also think that, I'm sorry. I also think that it's the businesses, but also the business people. And that the businesses, you know, there are insurance, there are ways that a person who's coming out of being incarcerated can be insured, so that if anything goes wrong,
You're talking about being bonded?
Bonded, exactly.
Some companies just don't want to deal with it.
Right. And the other thing is, I think that the awareness around the fact that the pathway for a woman to jail, that pathway is really not about being born bad. You know, we're not, these are women who have a pathway to jail that usually is grounded in relationships.
Yep.
And so the only way to change that story is to intervene through relationships. And women, Covington and Bloom have you know, a very strong research base around the fact that women are relationally oriented. And, you know, in order to reframe leisure, recreation, attitude, orientation, companionship, what it means to have boundaries, there has to be a new relationship. There has to be one person with one person. And it could be a business person, it could be somebody in the businesses, or it just could be anybody.
Great, thank you. Chris?
Yeah, I just to, you know, add on to, I think, you know, these are women that have burned bridges in the community. So when, you know, coming out and being able to, you know, really, you know, pull people in, landlords, because housing is a huge issue for women coming out of the facility and under DOC supervision. Nobody wants to house them because they have poor credit, they have, you know, criminal backgrounds and all those sorts of things. So, you know, and businesses for employment, all those kinds of things, and building those bridges. That these are, you know, most of the women incarcerated are not there for violent offenses at all. They're non-violent offenses, and you know, whether it's poor choices or addiction or trauma that, you know, got them there, they really have a lot of strengths and a lot to offer our community. And I think you're right, you know, just pulling in people that normally, and glad that you're here and really, you know, looking at that, you know, trying to get a job. You know, we successfully had a woman that got bonded, you brought that up, and was able to get a job, you know, and that was huge. So there's little steps, and, you know, working with people in the community that can help provide that. And I do want to put a plug in for the mentoring, because when we really had that going up here, it was a really great experience. We had community dinners, and mentors and the mentees would come, and we just kind of sit around, and we'd all, you know, eat pizza or make a dish or something and just talk. And it was a really great way. We got volunteers for our program. I mean, it was, you know, it was a wonderful experience. I really enjoyed, you know, talking with the women and getting to know them better. It's just, as a, you know, not just as director of Voices, but as you know, person that works in this community and cares about the population. It was just a really great experience. I would really recommend that.
Great. Back to relationships.
Yeah, it is about relationships. You're right.
What about schools? Not secondary education, but any thoughts on schools? Is there a role for so many women who are coming back that do have children that would be in the school system? Any thoughts on that? Yes.
I used to work in the school system. I was a paraeducator for a few years within different grades, and I saw many different relationships within the school system. There are many parents who want nothing more than to protect their child, and because of that, they put up these walls where, okay, you have a background, I don't want you near my family. Again, going back to building relationships, we need to openly somehow let this community know that just because somebody has been incarcerated for poor choices doesn't mean that they're bad people. In fact, they need these good relationships more than ever. The other thing is and again, I've seen this from parents, oh, your mom is in prison or just got out of prison, oh no, you can't play with my child. Again, it's building those relationships and making it public that they're human beings, and human beings need these relationships of any kind. And if you're somebody who's just exiting incarceration and hoping and praying and working so hard to better yourself and make a good home for your family and take care of everything, you have this baggage with you that you're just hoping you can let go of. But when people are blocking you like that, you end up resorting back to some of your old friends, your old relationships that may not be the best influences, that may not be the best mentors. So I think this more ties into your last question, I'm sorry. But somehow getting in there just to educate people, the rest of the community, that people can make bad choices and still be good people, and that that's okay, and we can help each other to become better people. I think that's going to be a huge, huge help to the community if we can get it out there, and I haven't quite figured out how
Yeah, I was
to
gonna
work
say,
yet.
how are you going to do that? Danielle, from your perspective in the Family Center, you're seeing younger kids and adolescents coming through your program. Any thoughts on are there gaps to be filled, or do we have good collaboration?
Well, I think mine would be a pretty global perspective, and I think from within our system of care, we tend to be reactive versus preventative and proactive. And so I think when we talk about reducing risk and maybe intervening before women get into prison, that to me is a place where we could really invest some dollars and some time, and then support people, and again, building the relationships and reducing the stigma for the women that are leaving. Because I mean, I've been on the flip side where we've been with families that have experienced a lot, and they're trying to advocate for themselves at a school meeting, and you can feel the breakdown and withdrawal just because of probably their own trauma and their own mental health and the judgment that they're putting on themselves. But when those old behaviors happen, then it creates judgments from, maybe school staff, or there's some miscommunication and actually what the needs are. And so I think that looking at it from a preventative will really help the overall system of care, and then two, really reducing stigma. I mean, from a mental health perspective, we do a lot to try to reduce mental health stigma. So why wouldn't you want to do that, with this population as well, when mental health is such sometimes a contributor?
And, a lot of the women incarcerated are moms, and the relationships with their kids are strained. They're not with their kids, and I often heard women talk about the saddest day in prison is Mother's Day, because they can't be with their kids. And, so they're coming out, and you're working with them to strengthen those relationships with their kids, so that they can have move forward, and that they don't lose custody of their children. That's real important.
And I would say even strengthening the relationships while they're in prison. Absolutely. Because that seems to be a real
and there's programs and that are helping with that, but that's a real important issue.
You know what we notice a lot, like I was saying to you before, getting to see young women who are seniors is too late, because most of them don't get that far. The young women that are, they're leaving school, probably some as young as 15. Why aren't they, and maybe they are, and maybe I'm just not educated in this area enough, why isn't the situation monitored more? Why is that child leaving school? I mean, because that's usually just the beginning of so much, and things that are already going on. But so I'm just wondering what's happening there. There's something that happens way before these women are getting to you.
So at that turning point.
Yeah, that's got to be where it is. That's what it seems like to me. I was telling them it's right around the time that young women are usually looking for a relationship, like you said, or addictions and things like that start coming into play, and then you've got babies, and it just spins.
Sure.
And by the time they've come into our office, I mean, there's so much to deal with that we can't possibly find them a job. We would love to, but it doesn't work like that. So it just seems like, I think it goes back again to parenting. I don't know what happened to all the moms, but I think they left the planet. It just seems like that. We're all the moms, and I think the community, especially the school community, needs to have a better, I don't know, watchful eye or something. There's too many kids that are falling through the cracks.
Tiffany, you've got something.
Well, you know, because nobody was tracking this at the time, we decided to take a snapshot of women who were coming into the system and what their employment histories had been. And because we needed data. And so what we found was, and again, this was a snapshot in time, but that 2/3 of the women who came in, who were incarcerated, had been unemployed at the time of their arrest. And of the third who had been employed, a very small percentage had actually been employed for any significant length of time. And we needed, what we found was that, in fact, when people were released and they would go to probation and parole, often a woman's employment wasn't a priority, nor was it being, did folks even record whether, we didn't know how many of folks who were on various caseloads were employed. That's a problem because there is an assumption, I think, we have to look at the impact we have to prioritize employment for women. It is, I struggle with mental health or substance abuse folks who will say to us, that's not the priority now, it's treatment. And that may be true for some, but a lot of studies have demonstrated that treatment is actually most effective when it is coupled with activity that is meaningful and that structures your time and that introduces you to new people. And so, and I've sometimes had a very hard time making that argument. And I think that, and I think where women are concerned, there is an assumption that there's somebody else to take care of them and take care of those needs. And there isn't for most of them, as we all know. And so, so unless we see addressing women's employment needs as an economic development issue, and I'm not talking about just women coming out of prison. I'm talking generally. Unless we're willing to look at gender. Because for a long time we've been saying gender doesn't matter, and it does matter because poverty affects women in a disproportionate way, and so I think that the emphasis that you're talking about in terms of focusing on employment and focusing years upstream is critical. And it's why I'm so happy there's a program like Rosie's Girls Up here, because it introduces girls to a broad range of fields they might never have considered. So anyway, that's I guess I'll shut up. I've said enough.
That's great. Kathy, and then we'll head across the room.
I wanted to address a little bit about your question about schools and in what way do the schools play a role. And I'm switching hats yet again. But for a duration of time, 5.5 years, I was working as the director of Open Doors, which was an influx of money to St. Albans City, Town, and Fairfield to establish an after-school extended day opportunity for youth so that they could continue to learn in ways that impacted community and was bringing the youth to the community and the community to the youth, and also was extending their learning experience from the day. And that was a safety net. That is a safety net. And the safety nets that can be established between the community, anytime there is a collaboration between the community, the schools, and the parents, that is the kind of collaboration that can yield results in this kind of pre-incarceration intervention. That is the way that you can build the relationships that can help people understand different ways of thinking. It's not possible for a teacher to teach all of the things, all of the social norms, all of the boundary preparation, all of the pre-work opportunities, everything. It is not even possible for just the schools to do that. It requires an entire community to focus on a child. And when that happens, it can change the way that person proceeds through their life. And they can become productive, and they can become work ready. It just requires that type of commitment in a sort of triad.
Thanks.
Tricia. This is more to just say that in Chittenden County, the United Way years ago, as one of their strategic initiatives, tackled the problem of truancy and had amazing results to the point of it getting some national attention. So since you're the mayor, and I don't know all the people up here, I just throw that out there that it might be a good program to model. And then I want to say to you, Tiffany, and that was so well said, women in work. Not that, everything that everyone has said has been important, but it's 2014 and Congress just did not pass. I can't.
We're still arguing whether a woman can be chair of the Fed.
Yeah.
It's 2014.
Here we are.
Speechless.
Well, so this is great. We've covered a lot of territory with these questions. I think what I'd like to do right now is we've got about 35 minutes, am I right, before the witching hour. So let's open up to questions from the audience, and we'll have some dialogue. And then we've got one final question. I'm going to target around quarter of or so to get back with the panel to do another round. So I'll take questions. Mike.
Maybe this is a question for Danielle. One of the things that hasn't been talked about as a barrier for women who are reentering that have families is childcare and access to childcare. And I know that's difficult for just about anybody, and I'm wondering, especially in connection, we're talking about, extending school days so that there's essentially wraparound for people who need to work. Is there a place that we can glue some of our progress we're making with childcare in order to help?
Well, for one, child care in Franklin and Grand Isle's issue in Grand Isle counties continues to be an issue. We are continually trying to raise the number of child care providers that we have available and the quality of the child care. So, I'm not sure if everyone is aware, but there is, through the Family Center, there is a team that you can call, and they will take referrals and support families in building connections to child care providers and finding out what the availability is and the needs of the children. So I'd really recommend that. I don't think that we have specifically built a connection to say, as women are transitioning out, how can we help them? But I think that's a fabulous idea. I just think, and with that, knowing childcare is an ongoing issue that we really need to address as a community to support a variety of families. I don't know if that answers it or not.
It's true, because people come into our office and it's almost like we feel like we should work for the Department of Welfare because people will come in and they ask us about, do we know any decent childcare? I can't get food. Yeah, there's so many things that people ask us. Health insurance, we'll print out applications for them, we'll direct them to the website now.
Get to the bus schedule.
The bus schedule.
It's interesting to think about the
bus schedule is
silos
huge.
that you cross. So there are no.
It's great because people need to, whatever door they're going to is where they need to get that assistance.
Yeah. Most of them don't even know that there might be a bus available. There's just so much information that they need.
Thanks. Okay, more questions. Did I see? Oh, yes.
I just wanted to compliment all of you. I work at the Chittenden Regional Correctional Facility. We have 157 inmates today, women, incarcerated, and only 9 are Franklin County. And only 1 could possibly be re-entered right now. The rest have lengthy sentences. So technically, you've all done your job. Jim especially. Jim reaches out. When we get a return from Franklin County, when Jim sends one back to us, we know all avenues have been exhausted. She's back because she has to be. That's why we aren't arguing the one we got. But it just shows the work that every one of you guys are doing, because Franklin County has the least amount of returns and a seriously high level of how many women are under DOC supervision in your community right now?
In our community?
Under your office, approximately.
100 or so.
So that's pretty even with some of the other smaller counties.
Has it always been that way?
Yeah, Jim, it's always been like that way. Well, in the last couple of years, before we used to explode, and I'd say, Jim.
Well, thank you for that recognition. Okay, so we've got lots of hands going up. Fear not, we're gonna make the rounds. I'm gonna go to the back of the room. Yes.
Yeah, hi. It's great to be back in Franklin County. I used to live here, and I was president of the Family Center years back in the 80s. So was my husband. So I can definitely vouch for the good work that you're doing. I'm a commissioner, and I saw this most amazing movie called The Little House and the Big House. It was one of the first things that we got educated about, and it was stunning, and it raises this issue. It's not just a question of women getting jobs, it's the kind of jobs that women are given. The Little House and the Big House is about this wonderful modular program where the women incarcerated it was up in Swanton, was it not? Who would learn how to build houses. And you watch the transformation that they have that this has on their lives. The fact that they can pick up a hammer and build something, it was very empowering to them. And they talked about how empowering it was. And we learned about all the great programs that were in the facility up here. And then we found out what happened when they got moved, which I know to the commissioners is tragic. It's tragic because there's no room for them to do it. When we asked what kind of work they do, they're sewing pillowcases. That is not empowering women. They need something that gives them strength and meaning in life. And I don't know what you in Franklin County could do on behalf of them, because it made a real good impression, certainly on me, and I think on the fellow commissioners, of what Franklin County did for these women. And to see them lose it, what can Franklin County do to try, I don't know, build a new facility? You're from Chittenden, you probably know the problems, but that's what they need. They need
superintendent
good
Well, whatever. All right.
Can I follow up on her?
Sure, follow, and then I think Marilyn's got a question next, so Bill, go ahead.
Yes, in January, I went to all the human resources directors, and anybody that had a facility in one of the 3 of the local area industrial complexes, and every one of the human resources director was open to the idea of employing people both with incarceration histories and with substance abuse histories, because they know 2 things, and these are facts. People born in 1957 are getting 1 year older every year. And that is making the manufacturers very nervous, because the unemployment rate is going to drop and drop and drop until it becomes a negative number soon. Now, that's not because jobs are getting created, it's because my generation is getting ready to check out. And the employers know this, so they're very open to every creative opportunity. And they're not against having people employed who have histories both of substance abuse and have incarceration histories. Because the other thing that they know is they test their new employees once, and on that one day they make a decision about whether or not they are addicted to things. And quite frankly, that's a scheduled event. And they know this, and they never look again. So they know that when you hire somebody who's been incarcerated and is in treatment, who's being monitored and is involved in healthcare, that's actually a better hire than the other 6 people, because 1 in 7 people are affected. It's not 1 in 7 criminals, it's 1 in 7 people. So they know that when they're hiring people, a person in treatment coming out of corrections is right now an actual safer bet as a new employee. So if you were to all come together again and say, okay, it's time for the big felon narcotic addict job fair. It would be actually.
Interesting. I think we've had those job fairs.
Well, it's not as bleak an environment. There's a lot of employers who are really looking for that next employee who could be trained and retained.
Thank you.
That's good information.
That is good information.
Yeah. Any, we had several comments so far. I haven't given an opportunity to check in any responses, check in thoughts, observations on this side of the room for the moment.
More a thought, I guess, related to what Tiffany said and what Bill, is that right? What Bill just said, and that is that, you know, maybe what we should be looking at is developing some kind of a wraparound program that gets people in the workplace right away, but also gives them the supports that they need in terms of whether it's recovery, maintenance, or other issues. And those workplace readiness skills, you know, tapping into our education and training providers, the tech center, whatever it may be, to make sure that people are continuing to develop those skills, but get them on the job. And you have to have a willing employer. You have to have a willing employer who's going to say, okay, I know this person is a work in progress, but it's worth the investment.
I just want to put a plug in that I think all this is really good conversation, and I just want to say that, you know, as I said, most of the women coming out have trauma histories, or currently experiencing some violence in their lives, and that needs to be tended to. So all these things that the wraparound services and so forth that we do, we all need to be trauma informed. Everybody who's doing this work and working with this population needs to be trauma informed, and that it's different than you know, understanding domestic violence, understanding sexual violence, and what that does to a person. That, you know, may have experienced that in their youth, as a child or as an adult or whatever. But that is just that being trauma informed really you know, adds to the quality of the services that we're providing.
Do you think there's a bigger gap in some areas than others in terms of being trauma informed? I'm just wondering, is that a gap to employers? Could we work to create more awareness?
I think we can always create more awareness. Yeah. I think we need more. I mean, NCSS has, you know, a huge waiting list. There's just a lot, you know, there's really a need for, you know, therapists, private therapists, you know, around, you know, to have that kind of experience so that they can help with that. But I think there's always more awareness that can be
I'm just
generated.
thinking from the non-professionals, yeah, how can we become better informed and aware and compassionate around those issues?
Well, I'll just say that we in large part because of our experience in working with women who are in prison, we developed a transitional jobs program, which is really, there's some employability work that we do for a period of 6 weeks. We also have a work crew component so they can practice the skills that they're developing, and it's usually in concert with the Intervale or other places where they can feel good about the work that they're doing and build skills. It's part-time to accommodate the other things going on in their lives. There are supports through the Department of Labor that can help subsidize these transitional jobs. And what we found is that it is often too much to expect somebody to be working full-time right when they get out of prison because of the requirements that either come from probation and parole or that are part of their treatment plan. So.
That's a good point. Transition.
Okay, yes. And I'll head back this way.
I just want to say,
it's been really interesting to hear what everybody does in the community. And the other thing that kind of comes to mind, I work at Probation and Parole as the risk reduction coordinator in St. Albans and Burlington, and previously was in the women's prison, so I've worked a lot with the women. Something that I hear a lot is how much stuff they have to do when they get out. So feeling really overwhelmed, but having work be a huge piece. So you kind of just spoke to this around having this part-time job, but how do we encourage them to pursue that part-time job and help them manage everything that is either expected of them or that they need to do for self-care? Because a lot of times work comes first for a lot of these women, or it doesn't come at all. So, good point.
Let's see, Marilyn, and then we'll head to the back.
Okay. I just had a few comments to make. First of all, we have an amazing group of providers sitting up here, many of whom I know personally or have worked with personally. One of the things that I'll speak to the schools as a former school person. Kathy Ainsworth is the person that worked with me to develop that Open Doors program that is still in existence and very supportive of children across this district. There's one in Venusburg, there's one in Richford, there's one in Swanton, so they're all over the state actually. The other thing, there are many opportunities in the Open Doors program for people to come in and to mentor. Okay, I'm also involved in the Watershed Mentoring Program, and I guess I believe in early prevention. And I actually mentor a little girl in Swanton, a little 8-year-old girl. I go and have lunch with her every Wednesday. And one of the things we have a really hard time doing with Watershed Mentoring is getting people, the business community, willing to let employees or people willing to go in and mentor students. And there's actually 2 mentoring programs there. There's one where it's a mentor where you spend time with them on Saturday, and there's another one, a lunchtime mentoring program. And I just think, and then the other thing I wanted to say is that the Business and Professional Women have a program called Can't Be PW, and we're beginning to reach out to the schools. And Sheila, this might be something that some of us could talk to you about. Yes. I've already had a conversation with Leanne Wright about it, and I think we're going to move ahead with something really pretty remarkable. And then I just believe early prevention, getting to the kids in the schools, because the history just keeps repeating itself in these families, as we all know that have worked with kids and families. Yeah. But I just want to thank all of you for everything you've said and done here tonight. It's really great.
Can I just echo a little bit? We are socialized, right? We are born into this world and we develop our norms and what we understand is true. And it may very well not be as true as we think. And we can be liberated from those stories. We can move away from those things. And I think early intervention is important. I think we do this. Work readiness is important. And when you talk with women coming out of jail, when they are really trying to make their worlds make sense, it sounds a lot like any woman trying to make their life make sense, except they have no shoes, they have no support, they have no resources. It is hard enough to be self-sufficient anyway, right? I mean, it is hard to have a job that pays the bills. It is hard. But in this case, if I had been in some of the shoes that I've seen, I would be that person. They are me, as much as they are they. You know, I did bring a quote, if you will indulge me. There are so many quotes, but we evaluate our mentoring program every year. And one woman this year told me, I have been clean for 9 months now. I want to go back to school full time because I can make my own decisions. I have been screwing up and checking out for so many years, but my mentor says, why go backwards? I haven't even known who I am. We just go walking, she and I, we read, we share books, and now I can be real and happy. And sometimes I can't believe it. But then she says, I can, so I do. And that's as it is. You know, we are in this together. And it can happen for people, but we have to realize that we are people, and we can be in it together.
Thank you.
Liz,
Oh,
I forgot
sure, and then we've got a couple folks in the back.
I'll just add one
Sure.
thing. We're going to be the October 18th up at BFA. We're going to be having a very similar discussion. Actually, Liz is going to be our moderator at the Women's Weekend Expo. It's our second year of it, and I have some. If people want more information on it, I can give you some cards before you leave. They're all looking at me saying you forgot the expo.
Okay, good.
Sorry.
Okay, and you've been patiently waiting.
I'm Arlene Boland, and I'm also a commissioner, and I'm over here visiting from the Northeast Kingdom. And a lot of the themes that you've mentioned about women re-entering are very resonant also with that very rural part of the state. But what nobody's mentioned, and I'm wondering if it's a challenge here, and if it's one you've overcome, is transportation.
Sure. Okay. So let's talk about transportation, and then I think what we'll do is we'll if there's a last question, we'll take that, and then we'll do the last panel question. So transportation. What do you think?
Yeah, speak.
That is a daily conversation with us. Yes. We have many people who they live here in St. Albans. They do not have transportation, so the only job they can take is the minimum wage job that they put up. This particular place puts up with too much bad behavior anyway, so people tend to get set back. They can't take a step forward because the only other jobs that they would qualify for are outside of whatever town they're in, and they can't get there. Transportation is a huge roadblock for growth for so many people, whether they have been incarcerated or not.
God forbid that bus go to Milton.
I know.
God forbid. Because we can fill so many positions. No, I can't leave. George is the last stop, right? That's it.
Yeah, unless you get.
Yeah.
Well, Milton is Chittenden County.
That's true. Yeah, but they're
then,
so.
Yeah, the cost and just.
Yeah, I know.
Maybe they.
So it's accessibility, it's cost. Other thoughts on transportation?
The time of the buses.
Yeah, moms going to Chittenden County. It's so hard. Then it's the child care issue, and
people have to get a bus at 5:30 in the morning to make it to Peerless for 8, which is already not a good job. I hope there's no one here
Say
for
that
Peerless.
again. At 5:30.
People have to get. People in North and Franklin County have to catch the bus at 5:30 a.m. to make a minimum wage job here in St. Albans.
For 8.
For 8. And they might have a child that probably has to get on the bus, but they'll figure out their own way. They're gonna have to, because I have to leave. Wow. And well, the other thing is there's some of them try to do the 7 to 4, but that's only if we have that available, because the last bus leaving town is at 4.
And the employer is not always willing to be flexible.
Yeah.
I think that's important. Thank you for asking that.
No, it is.
So to put a different spin on that also, though,
Sure.
10 years ago, there was no bus transportation here.
Yes.
No, yes, it could be worse. Of course.
Our clients rely on that transportation a lot, and it's not perfect. It needs to be better, but it is better than it was.
Good context, good perspective.
The only other transportation we have is taxis which people can't afford. So.
I mean, we could make the same argument that most people have to pick up their children at daycare, which isn't related to this, by 5. Who gets out and can be somewhere by 5? So that's just another. It's just these strange little times that are set up. Don't work with regular life.
Yeah.
To tie into the transportation, which you're all talking, and maybe that's one of the partners that's missing at this table is transportation.
Yeah, that's true.
That's a good point.
Because I hear it all the time from other people too, and certainly I've got relatives in that North Country, and they can't, you know, in part of Franklin County, and also in the Northeast Kingdom, there's no transportation. They can't get to where they need to earn an income.
I do the same position in Burlington office as well, and Barry. I go to all 3 branches, and the issue is there too. And huge.
Okay, I'm going to do a scan for final audience questions or comments. And if there are none, which I'm seeing none, I've got a closing question for the panel. I'd like to ask you, what one thing do you think would make the greatest difference to help women successfully transition back into the community? So I'll start on this end this time. One thing.
No, you're starting there.
Start here and go around.
think there is just one thing. I can't.
Well, you're all going to have one thing, so it's not that it will end up with just one. But I'll take anyone who wants to start the ball rolling.
Okay. I used to be a probation officer before I'm a supervisor here, and I had the women's caseload. So I wrote down two things: self-care, self-worth.
Very good.
We need to teach these women self-care and self-worth, because without that, they can't advance.
Yeah, I think that was worth going over the limit. Thank you. Okay, who's next?
I want to be very general and say opportunities. They need opportunities in our communities, whether it's jobs, whether it's housing, whatever it is, care, whatever it is, they need opportunities, and we need people to step up and help provide, as a community, provide those opportunities.
Great, thanks.
I think the early intervention to teach the self-care and the self-worth is job one. I really do.
And I'm going to add to that it goes to both genders.
Yes, absolutely.
Speaking of relationships and preventing future domestic abuse.
Okay, other closing
Well, I think a big word that I like a lot to reference to is empowerment. We have to find a way to empower people, because that is the bridge to get out of where you're at. If you look at upward mobility and you look at some of the studies, the Quality Opportunity Project, and that was done, that shows the bottom 5%, what does it take to move up? It's huge, and if you look at this population, they live in the bottom 5. And in the state of Vermont, I think it's 7% is your chances that you go from the bottom 5 to the top 5. New York is 9, and Memphis, Tennessee, it's 2.4%. So there is a tremendous look at how do we solve that, and that all the projects that are the most successful, some of these business incubators that build, some of these projects that have developed restaurants within the prison system so that they now teach them chefs and that, those are all based on empowering people to move forward themselves, along with the support that everybody has. That is.
I'd like to match your two and up it with advocates and mentors. And I just say that because we need to be informed. We have to talk to our legislators. We have to make sure that that we are encouraging mercy and assertiveness on the topics. There is a Vermonters for Criminal Justice Reform group run by Susie Wiziwadi. I believe she's still in the and that there is a website, www.Vermonters for Criminal Justice Reform, and that group is really trying to address these issues and trying to make sure that, for example, if we want our women out and we want our men back from the for-profit prisons, then maybe we need to up the treatment and the opportunities and have more advocates in the community to help with the wraparound services and get the women out, because these are not violent. A lot of this is about substance abuse, lack of housing, not violent offenses, just a revolving door. And if we can really advocate, mentor, find the compassion in our hearts, and find our voices, we can make a difference on this.
Thanks.
Can I go twice?
You can go twice. We've got time.
Just a quick story. A friend of mine works at, what is it called, Restorative Justice up here. And one of the things that she says to me that's a disconnect in the system is women come in, then they go through restorative justice instead of going through the court system. But they typically have to pay fines. And it's food off the table. It doesn't mean they shouldn't be held responsible and accountable for what they've done, but it's such a disconnect that by their having to pay the fine by a certain date, it often leads to bad behavior so that they can do other things.
I was gonna say something to that factor on the system of care and making sure that within the system of care we're talking to each other and have realistic expectations of what's going on, because if one silo has one agenda and one expectation and another silo has another one, oftentimes they are contradictory and not supportive to the women coming back into our community. So really that, and I would just, the second plug is reducing stigma around it, because it sounds like that's an overarching thing.
Very true.
Yes.
Well, I agree. We got to stop sending so many women to prison and sending them back to prison for violations of their probation. And but we don't have a whole lot of alternatives, and that's going to take some reform of the code. And I know that that's something that Bobby Sands and others are advocating. And so we've got to reduce the number of them, because because it's so disruptive for them to serve time. It's disruptive for their families. They lose their jobs. They may lose their housing. It just has this ripple effect that is really hard to reverse.
And it costs the state a lot of money.
Yeah. But the other thing is, I think that we got to really maintain a consistent focus on this. And I've been watching this for a long time now, and every issue kind of has its day, and then we pass a piece of legislation or we appropriate money for something, and then we think we've done it. And no, it's going to take a long time, I think, to make a real difference, and we have to stick with it over the long haul and be willing to do that. Because that's what it's going to take. And I mean, you all do. You stick with it. But that means the state government needs to stick with it. It means that, and it's hard. It's hard in a system where we elect the governor every 2 years. So,
thanks. Any other final thoughts? All right. I would like to really extend a heartfelt thanks to the mayor of this community for all of you for coming out tonight, for sharing your thoughts, your observations, your wisdom with the community. It's so important. Thanks to Kara and Danielle for your work to bring this to us. It's a real gift to the community. I think we've heard some really important themes that we can carry forward. So I look forward to this conversation broadening and continuing within the community. And thanks to everybody who is doing that now, committed to it, compassionate, and working to support women who are re-entering our communities. Any final parting thoughts from our organizers?
Thank you very much.
Great. Thank you, everybody.